Good evening, everyone present here. I am Faraz from CLIRNET. CLIRNET is very proud to be a part of this session as a digital partner. CLIRNET is India's largest live digital CME platform where doctors generate medical content. With all of you, I am presenting a short video on CLIRNET.
Thank you, Faraz. A very good evening, everyone. Myself, Dr. Venkatesh Karthikeyan, Community and Family Medicine postgraduate from AIIMS Patna. I'm glad to connect with all of you here on this wonderful evening. As we all know, healthcare is the most important aspect of human life and well-being. However, expenditures in healthcare sector remains to be a source of socio-political tension since the nation needs to spend a huge amount of money in this sector. And despite this, how successful the health outcome is going to be is a question mark. How do patients, healthcare providers, insurance companies, and governments influence how healthcare is distributed, and in what ways this situation can be improved? To all answer all these questions, the Indian Association of Community and Family Medicine, under the leadership of Dr. Aviraj sir, is organizing this webinar on health economics, which should serve as a primer to health economics outcome research. We have two wonderful speakers, Dr. Amit Mahto sir and Dr. Miguel Amézquita-Delgado sir. So first, I'd like to introduce Dr. Amit Mahto, sir. Sir is a medical doctor from India and is currently enrolled as a full-time student in M.Sc Health Policy, Planning and Finance course at London School of Hygiene and Tropical Medicine. After working for 3 years in different public health hospitals in India, he realized that certain health system issues which are far beyond the reach of clinical medicine is there. This prompted him to look for further study options that could provide him with specific skills in the health policy domain, which led him to end up at the London School of Hygiene and Tropical Medicine. I would like to invite Dr. Amit Mahto, sir, to sensitize all of us about what is health economics. Over to you, sir.
Well, thank you, Venkatesh, for your kind introduction, and I welcome all of the audience's interest in this topic. Now, it can be looked at from two different directions. When you see if your end outcome is health policy, it is affected on by several factors, and those factors could be empirical evidence, which includes epidemiological evidence, the burden of disease prevalence, and so on, the different power dynamics between various stakeholders involved, so politics, the funding. And I use the word funding here because it can mean differently for different people making the decision. For a hospital, it could be a budget or a financial statement. For a government, it could be, a national health budget. The culture, international relations, because as we live in an interconnected world, the global health policies eventually trickle down into national health policies and outcomes, affect the outcomes. And of course, the health system absorption capacity. So a totality of all these factors play a role into a health policy, which then affects the health outcome, which is our intention to improve. And I'd like to give you a brief introduction on Grossman model of health capital. And it basically starts with this notion that people gain utility, that is their outcome, for many things, and health is one of them. And when people are born, they receive an endowment of health capital, which depreciates with age. I'm sure we could all relate to that. And that depreciation in the health capital can be raised, or that can be controlled. The health capital can be improved by investments. And these investments are when people combine market goods and services to produce health. For example, we go to the gym to exercise. We go for screening of some diseases. We go to the doctor when we fall ill. These are all investments that includes a certain price, right? Now, the ability to invest in health depends on many things, like skills, knowledge, and education, and of course, income. And this consumption and investment in health, what we're talking about right now, is constrained by time, income, and prices. And I would, for a moment in time, would like to focus your attention on the income and price part of this investment in health. And for an individual to make a decision whether or not to go for, whether or not to buy healthcare as a service, it depends on whether the cost of the healthcare is equal to the benefits that they get. The cost is the monetary cost of purchasing. When you go to a doctor or a hospital, there is a fee that you have to pay to access those services, right? And are they equal to the benefits? The outcome is healthy days. So in totality, or to sum up, what I want to say is that there is the theoretical aspects of health economics, which enable us to think more critically about problems. And it fits into one of the many factors that we need to evaluate to go towards health policy, Ayushman Bharat being one of them, as I just gave an example of, to improve people's health outcome. We saw some theory about opportunity cost, the asymmetry of information, and the supply and demand. All of these concepts help us to develop and formulate empirical evidence. And with this empirical evidence, we are more enabled to make efficient decisions towards policy. And I guess with that, I would let Miguel take over and go into the empirical evidence side of things. Thank you.
Thank you, sir. Thanks a lot for the wonderful introduction, sir. I'm pretty sure this introduction has helped all our participants, including me, to change the perception that doctors need not know about health economics. Okay. So next, I would like to welcome Mr. Miguel. Sir is a senior consultant and the founder CEO of In Value Health Solutions, Colombia. He is the president of ISPOR Colombia chapter. He is a pharmacist, epidemiologist, and health economist. He has around 15 years of rich experience Colombian health sector. He has completed M.Sc Health Policy, Planning and Financing at the London School of Economics. With this brief intro, I'd like to introduce and welcome Dr. Miguel, sir. Over to you, sir.
Hello, everybody. Thank you very much. So Amit did a very good presentation about the theoretical aspects on health economics. And usually, when we start to work on health economics, say, why did you get bored to healthcare delivery to give patients, or in my case as a pharmacist, are you bored in your community pharmacy or hospital pharmacy? But at the end of the day, we take some concepts of the economy. The economy, it's a subject that is very well developed, and we try to adapt and understand in the health sector that had a lot of complexities and a lot of asymmetries to work on. But the best people that could work in health economics is the people who work in the healthcare sector. So I'm going to try to, and first, thank you for the invitation. I'm very glad to be here. I like to keep it simple and to understand or to ground these concepts that we are seeing with a commuting alternatives. If we are going to our work, if we are going to a point A to a point B in our city, we have some alternatives. We can go walking, we can go in a bus, in a public transportation, a little bit crowded. Here in Colombia, it's in Latin America, it's a little bit crowded, the public transportation. We can go by bicycle. That's a healthy alternative. We are going by our own car, we can go in taxi on an Uber or some platform. And the question is, what is the outcome that we are pursuing? Why the outcome that we are looking for? And could be several in this example. We are going to improve, or we want to improve the time, or we want to improve the comfort of the journey, the safety issues, the doing something with the laptop, or we are pursuing health benefits. So the key point that I want to highlight is that we have some alternatives and some outcomes, and in routinary basis, we do some comparison exercise, comparison between alternatives and outcomes. That's the basic of the HEOF in practice, to assess the equilibrium between the cost and the benefit. That's the basic concept. Elaborate a little bit more in the concept. So keep it simple. Okay, this is the bus and the taxi. I draw our two alternatives that we are going to assess, and the outcomes, the time. We have to save time in the journey. So in this part, yes, we can say, okay, we have three scenarios in the first, and that we are comparing how much time is spent by bus and how much time is spent by cab or by taxi, and how is the cost in this case in dollars to take a bus and to take a cab, and to make a comparison. How much time I am saving? 15 minutes. How is the cost that additional that I have to pay for? $15. Yes, we do this example in the three scenario when the cost is the same, but the time is different. In the scenario 3, look at that. Bus 30 minutes, sorry, and taxi cab 25 minutes. We are earning, you are saving 5 minutes and have to invest $15. So we are calculating some efficiency measure that just are calculating how much have I to pay, how much money I have to pay for the outcome that I am researching on or I am assessing on. So in this case, scenario 1, I have to pay $1 per 1 minute that I've saved. In scenario 2, we have saved $1.5 per minute, and in scenario 3, $3 per minute I save. Maybe the question is, what would be your election? What would be your election? Maybe for sure, you say, my election would be when the time saved would the most, and the cost would the same. Probably the scenario 1, yes? And this is the efficiency, because the efficiency measure are telling me that this is the most convenient scenario. However, do you know how much do you have to pay for that? So far, we don't have that information. And another kind of analysis that is called budget impact really say, okay, let's see if you take only bus, the cost is here that I'm pointing, and another three scenarios, A, B, and C, say, what if I would take bus or I would take taxi, 1 day per week? What if 2 days per week? And what if 3 days per week? And this is the impact and the additional effort in terms of money. So the key point of this slide is that this part, the incremental analysis, is informing us about comparative efficiency, but this part is not telling us how much money I have to invest or how much money I will save. So the other part, the budget impact part, are informing us about the affordability. Remember, the affordability in our context is if I'm able to pay for that. Yeah. I hope in this example, I mean, it's a very simple, but when I'm teaching, I try to keep it simple to ground the concepts on the comparative efficiency and the affordability things. And actually, in this part, the incremental analysis is what is called the incremental cost effectiveness ratio. That is a very, very used method to assess this in health that we are going to say and ground the example as well. But I hope that the concept could be better understood with this example.
That piece is not something that you can do without. You have to incorporate it. And the theme of that is, and I guess Miguel and I have been saying it again and again, the budget constraints, the resource constraints, it's the reality. So that is an important piece. Given most of the audience are, in public health, they want to make a career in public health, I would say that if you only knew about epidemiology of the disease, well, that's great. If you only knew about how to prevent a disease or to treat a disease, well, that's great. Different aspects, but then you also need to know to have like a total picture. So one, why it's important, but then to make a career, well, I guess differently. If you pursue health economics training, a formal training, then you would be able to do these things like Miguel does with his organization. Then you are a health economist. Then you can find jobs of, advisor, health economist, scientist, and so on, where you will be doing these analyses, these models, and giving people evidence, right? But I would say even if you are an epidemiologist or a public health expert or researcher, you still need this knowledge and skill to be able to parse the information that is coming to you. You cannot say that, okay, that is not my domain, let someone else do that. So what I want to say is that as a profession purely, of course, you can be a health economist. It's exploding. And this is not an overstatement, believe me, this field in terms of the job. But then the other aspect is, if you are not a health economist, if you're just a public health expert, for you to know this makes you better at the job you're doing. So in a way, it sort of improves your, I don't know, chances of jobs and everything in different aspects.
Great, sir. Thank you so much, sir. Amit sir and Miguel sir, for giving us a overview about what health economics is and what are the practical applications. As you rightly pointed, it's a very broad topic which needs, I mean, like you're doing a course on it and expecting us to know everything in a 40-minute session is quite difficult.
No.
But still, I think this will be a primer for our participants who have joined in today's session. Thank you so much, sir, both of you. Now, I'd like to introduce Dr. Aviraj, sir, Senior Resident of Community and Family Medicine in in AIIMS Bhopal and the President of Indian Association of Community and Family Medicine, without whose support this webinar would have not been possible. I would like to welcome sir and invite him to share a few words with us. Over to you, sir.
Thank you, Dr. Venkatesh, for this great coordination and for the introduction. I would like to thank Dr. Amit, Dr. Miguel for this wonderful and informative session. I know, as Dr. Venkatesh and sir also said, it's very difficult to cover health economics, even introduction per se, in a short span of time. Being an Anthor myself, I know it's very difficult and very vast topic, but yes, sir had done a very good job, and also sharing your practical aspect and co-linking it with the theory was very helpful, because health economics is one domain where it is very least studied and least taught, and also we more study at the theory part, and the practical aspect of it is not studied. And it was very great that you could give examples, and thank you so much. And definitely we would be looking for a more better session, and Indian Association of Community Family Medicine is thankful for this wonderful webinar by both sir, and we'll be looking forward to a better workshop where we could learn in more details into it. Thank you so much everyone for this webinar.
Thank you.
Yes, thank you for inviting me. As Amit said, it's a real life topic. Actually, as elaborating a little bit in the previous Amit comments, say, okay, all people say, okay, we need more budget. And a question that I do to my students is, okay, you have $1 million. How would you invest it? I say, more physicians, more facilities, more what? So the issue is budget constraints on one hand, but on the other hand is where is more efficient to allocate the resources. So that's the point that I mean, it's a easy point, but yes, okay, what if you have a lot of money? How do you invest in? And if you work on outcome research, if you know how your population is performing the basic health outcomes or specific health outcomes, you could have a better information in how to invest the resources. So that's like a invitation to get deeper in this topic. This is a fascinating area of the knowledge, because at the end of the day, better outcomes efficiently and affordable is that we are pursuing.
So we are coming to the far end of the session. If you have any further queries or feedbacks, you may please fill in the feedback forms, which we will be circulating with you shortly in your registered email ID. So thank you so much, everyone. Thanks to our audience, Amit sir and Miguel sir, Naviraj sir. We'll meet in our next session. Thank you.
Okay, bye-bye.